Welcome back to Plant-Based Kidney Health, everyone. Michele Crosmer, Dr. Hashmi here. And today we're talking about the popular Ozempic and kidney health and kidney disease. So, Dr. Hashmi, let's get rolling. What is Ozempic and what is it used for?
Yeah, so remember, a lot of the new drugs that we're talking about, they're actually diabetes drugs. So Ozempic is part of a class of drugs called GLP-1s or glucagon-like peptide 1. And essentially what they were used for was controlling sugar. So their main mechanism in regards to diabetes is they will cause more insulin to be released from your pancreas. But they have a couple of other mechanisms that are very interesting. They delay food from leaving your stomach fast. So they call it delayed gastric emptying. Now, too much of a good thing is bad. So one of the side effects of drugs like Ozempic, Wegovy, Mounjaro, that's rare. I just can't tell you how rare it is because we don't have the data yet, is that in some patients, it's caused permanent blockage of their stomach or stomach paralysis. So we call it gastroparesis. So one mechanism is delayed gastric emptying. They cause more insulin to come out of their pancreas. And the third thing is they tell the brain to not feel hungry. So they affect the appetite centers in the brain. So those are essentially the three big mechanisms when it comes to drugs like Ozempic. And then when we start to get into the idea of, well, are they helpful? Are they harmful when it comes to kidney disease specifically? So remember, the three biggest causes of kidney disease is diabetes, high blood pressure, and of course, weight. So from that perspective, drugs like Ozempic or Wegovy or Mounjaro or Saxenda or Zepbound, all of these drugs, and Victoza being another one that's used for diabetes, but all of these drugs, they will help to improve the diabetes. And at higher doses, they will also lower the weight. And because of those two things, the blood pressure will go down. So from a bigger picture, they're absolutely helpful, but there's actually more to it than that. And the more part is that they can also lower protein in the urine. And that's kind of interesting because they can work on top of the drugs we use, like SGLT2 inhibitors, which we've talked about on this clinic. Names like empagliflozin or aldaflozin, dapagliflozin, or brand name for EMPA is Jardiance. So in other words, there's a lot of benefits that are associated, but there's a lot of danger side effects. So one was the stomach paralysis. Another is there's a small risk of things like thyroid cancer. There's another risk. And the third risk is that patients, especially when they first start, can actually have worsening depression or even suicidal thoughts. Because anytime you block the appetite centers, you have to be worried about this. And if you have vulnerable populations, it matters. Now, after the first few months, as you start to see visible weight loss, your mood gets better. But when you first start these drugs, you have to be aware of the risk. So, in terms of potentially harmful or potentially helpful, there's a lot of good things, but they're not our first line agents when it comes to that. One, because they're ridiculously costly, but two, because there are a lot of unknowns. And we have very good agents that we have decades of experience of having knowns that we can use.
Got it. So it sounds like, I mean, obviously, there's because they can lower blood sugar and potentially lower weight, the big umbrella picture. Obviously, those things can help with kidneys, but they haven't been used or tested specifically in the kidney disease population, then, right?
They haven't been tested. They are being tested now. So what the studies right now show is the way that they can be quote unquote kidney protective is a couple of mechanisms. First is they can actually cause you to have natriuresis, which is a fancy way of saying they will cause you to lose salt from the kidney. That's a good thing. You want to get rid of salt, and that's how they can affect blood pressure, protect the kidneys, and so forth. The other things that the data shows is that they can reduce the oxidative stress and the inflammation inside the kidney so they can directly impact the kidneys from getting worse. On the flip side is they can also cause significant nausea, vomiting, diarrhea. They can dehydrate you, so you need to be very cautious. But on the positive side, just remember is there is a couple of mechanisms that are direct to kidney protection, natriuresis, and reducing directly the oxidative stress.
Gotcha. Okay. Of course, any medication, pros and cons, right?
Yeah.
Um, are there, I guess, just kind of summarizing, then what would be the key takeaway for someone who has kidney disease that might be considering talking to their doctor about going on a medication like Ozempic or one of those other ones you mentioned?
I think one of the things that patients need to understand and all of our audience needs to understand is there is no such thing as a magical drug. So in other words, sometimes people come in and they say, "Doc, all I want is Ozempic because I heard I'm going to magically lose weight." Well, that's not necessarily true. What happens is initially your appetite's gone, you feel like magical, but if you're not making better habits, about 12 months or so into it, the number of patients that are quitting Ozempic and other drugs is dramatic. And the reason for it is because they learn or their brains learn to overcome the effects of these medications. So if you said, what should you know if you wanted to start Ozempic is are you ready to commit to a healthier lifestyle? Because if you're not, don't start a drug because what's going to happen is that will be another failure. Do the drug and combine it with a healthy lifestyle along with it. And if you do both those things, you're going to have tremendous success. But if you just rely on the drug, you're going to fail. The other thing is be careful about I'll pick on a brand name, so please don't get mad at me. I know some people get really offensive, but Amazon has a subscription model. And weight loss drugs are almost like that because once you start a weight loss drug, you are on it for life. If you stop it, the weight's going to come right back. So realize that you are giving up control to a drug. And that's not a bad thing if you're able to say, hey, I need this for this and that reason. But if you don't need to go there, don't go there. You know, I know it sounds boring to sleep, to move more, to stress less, to eat more plants, but it works. And if you can do that and you can surround yourself with positive people that lift you up in life, you'll be very successful. There is no shame in going on a drug, but we always recommend that and lifestyle should be the predominant thing. And please talk to your nephrologist, somebody who has experience with these drugs, who can go through all the pros and cons. Nobody on Instagram, TikTok, YouTube is talking about their failures with these drugs. They're not talking about the damage it's done to their life. They're out there saying, I took this drug, look at all the weight loss I did. And it's guys like me who are talking about the balanced view. I have so many patients because remember, I do obesity medicine and I do nephrology. So I'm a kidney doctor and I'm a weight loss doctor. And I have tremendous success stories, but I also have tremendous failures where patients have really been affected by these drugs. So the take home is really be balanced. There are no shortcuts in life. And the slow path is truly the fastest path to where you want to get to.
I love that. And thank you for being transparent with all of us about that because I think that's really important for people to hear. So, there you guys have it on Ozempic and kidney disease, and we'll see you next time.
Thanks, guys.